What if the subtle changes in your vision are more than just part of aging? You might be overlooking warning signs that could indicate a serious problem. Today we're going to discuss 5 warning signs that your vision may be declining, and why catching them early is so important. Vision loss doesn't happen suddenly, but small changes like blurry vision or trouble reading can easily be ignored until it's too late. Conditions like age-related macular degeneration, cataracts, and glaucoma can gradually affect your eyesight, and if you don't act in time, they could steal your vision. But could something as simple as a lifestyle change or an eye exam help prevent further damage? Stick with me as we explore these signs you shouldn't ignore. By the end of this video, you'll know exactly what to look for and how to take action before it's too late. Sign 1. Blurry or cloudy vision. If you've been noticing blurry or cloudy vision, even while wearing your glasses or contact lenses, it's time to take notice. This could be one of the first signs that your eye health needs attention. We're not talking about a day where your eyes are just dry or irritated. This is the kind of blurriness that sticks around. It might happen when you're reading, watching TV, or even looking at a street sign, and everything just seems a bit off. So what could be causing this? Conditions like cataracts, age-related macular degeneration, AMD, and diabetic retinopathy are common culprits. Imagine waking up, thinking you can easily read the newspaper, but the words seem smudged. This could be a sign of cataracts, where the lens of the eye gradually becomes cloudy. Cataracts are actually one of the leading causes of vision loss in older adults, but the good news is they can usually be treated with surgery. Then there's age-related macular degeneration, AMD, which affects the central part of the retina, the macula. Over time, AMD can cause blurry spots or even complete loss of central vision. In fact, about 2 million Americans over the age of 50 are dealing with some form of AMD. So if you've noticed your vision becoming a little fuzzier, especially when you're reading or trying to recognize faces, don't just brush it off as a normal part of aging. It's worth looking into. But don't panic. There are ways to catch these conditions early, and in some cases, prevent further vision loss. It all comes down to paying attention to the signs and seeing an ophthalmologist before blurry vision turns into a bigger issue. Have you noticed some of these symptoms recently? Or maybe you've been feeling a bit concerned about your vision. Well, stay with me, because we're about to look at another important sign that could be affecting your eyes. But first, let's take a moment to think about how your vision is really doing. Sign 2. Difficulty reading or seeing details. You know those times when you're reading a book or looking at a menu, but the print just seems to slip through your fingers? If you're struggling to make out small text or finding it hard to see fine details, even in good lighting, it might be more than just tired eyes. This could actually be a sign of presbyopia or even age-related macular degeneration, AMD, both of which are common as we get older. Presbyopia is something we all experience as we age. Over time, the lenses in our eyes lose their flexibility, making it harder to focus on objects up close. If you found yourself holding your book or phone farther away to read, that's a pretty clear clue. But here's where it gets tricky. If you're also having trouble recognizing faces or seeing details in the center of your vision, it might not just be presbyopia. That could be a sign of AMD, which affects the macula, the central part of the retina, where your sharpest vision occurs. If left untreated, it can make reading or even performing everyday tasks much more difficult. For instance, imagine trying to read your favorite book, but the words appear hazy, or you can't quite make out the small print on a grocery store label. You might think it's just part of getting older, but it's important to understand that AMD can cause these exact problems. It doesn't happen all at once. It sneaks up gradually, making your central vision blurry and distorted over time. If this sounds familiar, it might be time to get a comprehensive eye exam. An ophthalmologist can help determine if you're dealing with presbyopia, AMD, or something else, and they might even suggest treatments to help preserve your vision. So, if reading is becoming more of a challenge, it's definitely time to take action. Your eyes will thank you. And while we're on the topic of vision changes, have you noticed how colors might seem off or harder to distinguish? That's another common symptom you definitely shouldn't ignore, and we'll take a closer look at it next. Sign 3. Changes in color perception. Have you ever had trouble distinguishing between colors? Maybe you've been looking at a sunset, but the colors don't seem as vibrant as they used to, or you're holding up two shirts and they seem to blend together more than they should. If colors are starting to appear faded or harder to tell apart, it might not just be due to the lighting. This could be an early warning sign of an underlying issue with your eyes, such as age-related macular degeneration, AMD, or even glaucoma. Let's break it down. AMD affects the retina, the part of your eye responsible for processing light and color. As the condition progresses, it's common for people to notice colors appearing washed out, or they may struggle to differentiate between certain shades. For instance, you might have difficulty telling the difference between a light blue and white shirt, or perhaps the greens in a landscape seem less vibrant than they once did. Then there's glaucoma, a condition that affects the optic nerve and can also impact how you see colors. If left untreated, it can lead to vision loss. But the good news is that early detection through regular eye exams can help prevent further damage, and there are treatments available to manage the condition. So if you've started noticing these changes, whether it's trouble distinguishing between colors or things just don't seem as vivid as before, it's a good idea to schedule an eye exam. Your eye care professional can help pinpoint the cause and provide guidance on the next steps. Now, while we're on the topic of vision changes, there's another issue that could seriously affect your daily life: difficulty seeing at night. If driving at night is becoming more challenging, or if you're struggling in low-light situations, stay with me, because we'll explore that next. Sign 4. Difficulty seeing at night. Have you noticed that driving at night is becoming more challenging than it used to be? Or maybe walking through a dimly lit room feels a bit riskier now. If you're having trouble seeing in low-light conditions, it could be a sign of something more serious, like diabetic retinopathy or cataracts. Let's start with diabetic retinopathy. This condition occurs when high blood sugar levels damage the blood vessels in the retina, affecting your vision. As a result, you may experience blurry vision or difficulty seeing at night. If you have diabetes and notice this, it's important to talk to your doctor, as untreated diabetic retinopathy can worsen and lead to permanent vision loss. On the other hand, cataracts are a bit different. They happen when the lens in your eye becomes cloudy, making it harder to see clearly, especially at night. Imagine trying to drive and seeing headlights as halos or feeling like you're looking through fog. This is what cataracts can do to your vision. Cataracts are very common in older adults, and although they can be treated with surgery, it's important to detect them early. If you've noticed difficulty with your night vision, whether it's trouble reading street signs, dealing with glare from headlights, or just feeling like the world isn't as clear when the lights go down, it's time to schedule an eye exam. Don't ignore these signs, as conditions like these can be treated or managed with the right care. And while we're talking about vision issues that can impact your daily life, have you ever seen floaters or flashes of light in your vision? That's another important symptom to pay attention to, and we'll discuss it next. Stay with me. Sign 5. Seeing floaters or flashes of light. If you've ever looked up at the sky and noticed little specks or squiggly lines floating across your vision, you're not alone. These are called floaters, and while they're usually harmless, they can sometimes signal something more serious. Similarly, flashes of light that seem to appear out of nowhere can also be a warning sign that shouldn't be ignored. If you're experiencing either of these symptoms, it's important to understand what they mean and how they could relate to your eye health. Floaters are typically tiny clumps of gel or cells inside the vitreous, the clear, jelly-like substance in your eye. As you age, the vitreous shrinks, and floaters become more noticeable. While they're often a normal part of aging, they can sometimes be linked to more serious issues like retinal tears or retinal detachment. Retinal detachment is a medical emergency where the retina pulls away from the back of the eye, and it can lead to permanent vision loss if not treated right away. Flashes of light can also be caused by changes in the vitreous or retina. If you suddenly start seeing flashes, especially in your peripheral vision, it could indicate a retinal tear or detachment, which requires immediate attention. It's not something to dismiss as a minor annoyance. This could be a sign that your retina is at risk. So what should you do if you notice floaters or flashes? Don't wait. Schedule an appointment with an ophthalmologist as soon as possible for a thorough exam. Early detection of retinal issues can make all the difference in preventing further damage and protecting your vision. Now that we've covered these 5 important warning signs, let's talk about how vision problems can impact more than just your eyesight, specifically, your cognitive health. There's actually a link between your vision and brain health, and you don't want to miss it. Did you know your eye health is closely linked to your brain health? It might surprise you to learn that vision problems can actually contribute to cognitive decline, especially in older adults. As our eyes age, vision deterioration doesn't just affect our ability to see, it can also have a significant impact on our mental and cognitive health. Studies have shown that people with vision loss, particularly in later life, are at a higher risk of developing cognitive conditions like dementia. A study published by the National Institutes of Health found that older adults with vision impairment are much more likely to experience cognitive decline compared to those with healthy vision. The connection is thought to stem from the fact that vision problems often lead to social isolation, reduced mental stimulation, and lower activity levels, factors that contribute to cognitive decline. But don't worry, having some vision challenges doesn't mean you're destined to face cognitive issues. The good news is that taking care of your eyes early on can help preserve both your vision and your cognitive health. Regular eye exams and addressing vision problems like cataracts, glaucoma, or age-related macular degeneration, AMD, sooner rather than later can help reduce the risk of these problems affecting your brain health. This connection between your eyes and brain health shows why it's so important to catch vision problems early, and why maintaining your eye health is crucial to your overall well-being. The sooner you detect any changes in your vision, the sooner you can address them, which could also help protect your brain health as you age. Now that we understand how closely your eye health and cognitive function are linked, let's move on to what you can do next. Stay with me, because we're about to dive into some practical steps you can take to protect both your eyes and your mind. Now that you know the warning signs to look out for, the next step is to take action if you notice any of them. Whether it's blurry vision, trouble reading, difficulty seeing at night, or even floaters or flashes of light, your vision is too important to ignore. Catching potential problems early can make all the difference in maintaining your eye health for years to come. First, if you're noticing any of these signs, schedule an appointment with an ophthalmologist. A comprehensive eye exam will help identify the cause of your vision changes and give you a clear plan for treatment. Whether it's cataracts, age-related macular degeneration, AMD, diabetic retinopathy, or another issue, your eye care professional will know the best course of action. But eye care isn't just about what happens in the doctor's office. You can also adopt healthy habits that support your eye health every day. A diet rich in antioxidants, like leafy greens, carrots, and citrus fruits, can help protect your eyes from oxidative stress. Managing your blood pressure and blood sugar levels is also essential, particularly for preventing conditions like diabetic retinopathy or glaucoma. And of course, avoiding smoking is crucial. Smoking increases your risk of cataracts, AMD, and other conditions. These simple lifestyle changes can go a long way in protecting your eyes, but staying proactive is key. Regular eye exams are critical for early detection, so don't wait for symptoms to get worse. Schedule an appointment with your eye doctor today. Taking care of your vision is about more than just seeing clearly. It's about preserving your quality of life, staying independent, and protecting your cognitive health. So, what's your next move? Will you take action now to protect your eyes, or will you wait for problems to surface? The choice is yours, and your eyes will thank you for it. Now that you've learned about the key signs that your vision could be declining, it's time to take action. Are you really paying attention to your eyesight? Could those small changes be signs of something more serious? Your vision is one of your most important senses, and taking care of it can improve your quality of life, protect your independence, and even enhance your cognitive health. So, what's your next step? Will you schedule that eye exam? Or maybe start eating more foods that support your eye health? The choice is yours, but the time to act is now. If you found this video helpful, don't forget to like, share, and subscribe so you can stay up to date with more tips to stay healthy and live your best life. And make sure to turn on notifications so you don't miss out on any future content. Also, don't stop here. Click on the next video that just popped up on your screen to continue your journey toward better health. Take care of your eyes, and I'll see you in the next video.